Great. Hi, welcome to the questions panel, where we'll be talking about what questions to ask and how to ask them. I am Sheree Faker, the marketing director for ENCOPE. I've been a prosthetic technician at Dankmeyer, ran operations for a range of motion project, and until just recently was the director of sales for Psionic, so all over the place. But you've met Nina and Chris already, so together we're going to be highlighting all of these questions, but real quick, I wanted to mention who Nina is. She coordinated this event, went to NUPOC and graduated from there, was a resident at Dankmeyer, and is the current Cascade Orthopedic clinical educator. So the three of us are going to be doing a role play exercise, going over some questions and how to ask them, and that will help you to best use Friday's interaction with the employer exhibit hall. If you have more questions, please write them in the box on the side and we'll get to them. All right. So the first question, I'm going to be playing the role of the student and resident. Nina will be the potential employer, and Chris will come in with some expert feedback. So the question is on compensation, salary, and benefits. My question, how much will you pay me, and how many days off do I get?
Hi, Shree. We're so glad you're interested in our site. That's not information I can disclose at this time, but perhaps it's something we can discuss at the interview stage or perhaps the offer stage. But thanks so much for your interest. Chris, I'll pass it to you for some additional input.
Sure. So one thing to keep in mind is it's okay to frame a question in terms of, do you offer standard benefits to all employees? Because keep in mind, as a resident, full-time benefits are something that are typically sent to the resident as well as other individuals. Only in certain settings will you find that the resident benefits are different. And typically that's an academic situation, mostly because you're on a stipend and not a true salary. So simply asking the question, could you let me know what kind of benefits are offered to all employees? Or do you have a web page that's available? And it's okay to even take that next step. You'd like to say, at this point in time, I'm not eligible to have health insurance benefits under my parents as I'd offered, but be careful in terms of disclosing any potential health ailments that they have. They can't discriminate against you for having health ailments, but at the end of the day, you also don't want to impart any potential bias as well. So framing it in an inquisitive manner. And then the other thing to keep in mind is some organizations are very transparent. They have fixed compensation rates. So university settings, for example, say this is a resident salary. This is what we pay, whether you are incredibly experienced or not. There's also larger companies that offer this as well. In general, if we take a look at the AOPA salary survey where they actually inquired residents recently, that number is right around $39,000, excluding benefits for the actual just pay component. So the salary is typically around $39,000 as your average based on the AOPA salary survey. And the variability typically comes with cost of living. So payments typically slightly higher in metropolitan areas like Washington, D.C. or Chicago versus Fargo, North Dakota.
Right. I like to reinforce that this is not a no question, but it's making sure you're asking it at the right time. So this is perhaps not the best time to ask at a resident fair, but certainly down the road when you're further in the process, I think this is an appropriate question to ask.
Yep. And if you have an offer, you always can say, am I allowed to, is there a possibility of discussing higher compensation given my qualifications? Is a nice way to ask that.
Awesome suggestion, Chris. So we'll head over to another hot topic. So weekend and nights on call requirements. So I'm the student in this scenario, Shree is the employer, and Chris is still our expert. So now I'm pretty stressed about residency and worried that if I work on the weekends, I'm going to get totally overwhelmed. Will I be expected to work on call? What about weekends?
It's a great question. So every residency site is going to have a different take on this, and that is going to be the difference between hospital sites and private sites, which was also something that Teresa mentioned in her presentation earlier. So it's definitely a question worth asking, but to also think about how you phrase it, of what is the normal expectation for a resident for weekend or on-call shifts? Chris?
And to piggyback that, keep in mind, On-call in a hospital setting often relates to prefabricated devices. So for those of you that are thinking, well, what if I'm not yet competent? Can they ask me to fit a prefabricated knee immobilizer? And the answer is yes, they can. So if it's a situation where it's part of the employment, understanding that is going to be key. Some sites offer additional compensation if you are activated on call, and some sites have an expectation that it's included within your base compensation as well. The other thing to consider is some sites will actually allow you to offset time spent on call with paid time off later. So it's entirely possible they may say you spent 6 hours fitting prefabricated devices last weekend. You have earned 6 hours of paid time off that can be used at a later date when you're not required to perform those services. So understanding how that is handled is going to be useful and a follow-up question worth asking.
And also probably a question that would be best answered during the application interview phase as opposed to during the resident fair on Friday, but you can definitely get your feet wet with it. So here I'll be the student / the resident asking about leadership and unique learning opportunities. So what opportunities may exist for leadership amongst co-residents and unique opportunities to learn what this clinic and company offer?
Shri, this is a great question. We're so excited you're interested in these leadership opportunities. That shows a lot of initiative. And so as an aside from that, you're going to see a pretty wide variety of responses. You'll see very quickly in this field, every clinic is different. So they're going to have very different learning opportunities, whether that's different clinics, different patient populations. There may be a lead resident position, there may not be. So this is a fantastic question to ask in this forum. It shows initiative, it shows forward thinking, and it also shows that you want to be involved in the organization beyond just the 9 to 5, 8 to 5 seeing patients. And this is what folks are really looking for. So expect to hear a good wide variety of responses to this question from employers you're speaking with. Chris, over to you.
And a good qualifying question is to identify if the site commonly retains residents after residency as employees. Because if you're pursuing and trying to ask the fundamental question of, is there an opportunity for me to work my way up within your organization? A nice way to frame this is, what is your philosophy on career advancement within your organization for individuals that start as residents? And then I take the next step and ask, can you provide some examples of individuals that started off as a resident with the organization and now have a role as a clinic manager, for example?
Awesome pivot. I like that. Here we'll be talking about some ways to perhaps ask about funding for conferences and exams. I'll be the student in this scenario. I took out a good amount of student loans for my education. I'm pretty stressed out about paying those back, but I still want to be active in the profession. I know that exams are expensive, and what if I fail the first time I have to take it again? So do you cover exam fees, and do you send residents to conferences?
Well, Mina, this is a great question. And to everyone watching, this is a great way not to ask the question. That means very well. So it is really worthwhile to know what residents are going to be offered. This is one of those benefits. Is there funding available for attending conferences and or funding for taking the board exams? However, this is also one of those instances where asking the question where you're wondering what is usual for a resident at the company is a better opportunity to understand their philosophy as opposed to how it directly relates to you. If you are going to give a direct example, that is a conversation to save for during the application interview process once you've already established a relationship.
Now, if you wanted to ask something at the career fair, it might be an interesting way to say, do you have any employees or recent residents that were actively involved with professional organizations like the Academy or AO, but were involved with presentations? That would be a kind of a neat way to see if there's a parallel.
Yeah, great suggestion. I like that. So there's ways to get the information you're looking for, but not asking directly, because those questions may be perceived negatively. So just think about the wording, think about how it might be perceived. These are important questions, but you have to figure out the right forum, the right way to ask those as well.
So this is a really important one right now. I'm going to be playing the student. What is the company's position on diversity initiatives and all things DE&I? So DE&I standing for diversity, equity, and inclusion. So question being, the past year and a half has been very overwhelming with race relations, and I'm curious what the company's DEI initiatives and stance are. Also, can you tell me about the patient population as it relates?
Thanks for your question, Shri. And I'll say you're not going to hear a common response across employers. Everyone has experienced DE&I in different ways, and you should be prepared for that range of responses. Some folks might be really on board and have a program and a plan and be very willing to share that information. Other folks may not have given it a lot of thought, and just be aware that neither of those responses is right or wrong. People are at different points in thinking about this topic. So just be open to how folks will respond. If it's important to you, absolutely ask it because that's what you're interested in. But just be aware you're going to hear a good mix of responses. So certainly if you're interested, go for it. Chris, over to you.
Yeah. And I think DEI is something that is of value to a lot of organizations. Those of you that were in the NCOPE talk saw that that's one of our goals as an organization, to actually foster individuals that are representative of the patient populations that we serve. And depending on your metropolitan area, that might not be as strong of a conversation because some of the populations might not even be physically present. Unfortunately, there's just a lack of awareness that's present. But also I've seen some students that were really pragmatic about introducing and starting that conversation. There's a young lady that presented with us at the AOPA meeting recently who moved to a very Caucasian ethnic region, if you will, within upstate New York. And she's of African-American descent. And she actually had patients comment that I've never seen a healthcare provider within my metropolitan area that was of your skin color and a woman. And it was just mind-blowing to have that conversation. The fact that she was also trained and appreciated, how do we continue this conversation? Here's why it's valuable that I serve my community. So you'll find that even if you might be in an environment where the employers and the opportunities might not be as aware, the one thing that I've been so impressed by with the students and the individuals seeking their second residency is this awareness and this cultural inclusion. So I feel that if it's of truly something you value, it's present within our profession as well, but you sometimes have to educate to get there.
Yeah. Thanks for sharing that anecdote, Chris. And it's not anecdote, sharing that experience. And if that's something important to you and your employer isn't necessarily strong in that area, that's an opportunity for you to make that change happen if it's important. If they say they're not doing a lot in that area yet, that's a chance for you to improve that spot too. So see it as an opportunity. There's plenty of chances for all of us to grow. So definitely go for this question if that's important to you.
And it's a conversation happening in the professional organizations as well. So if they're saying, well, could you give me some examples of within ONP where this conversation is occurring? The session that just occurred at AOPA, that was our main focus. The behavioral sciences work group within the academy, the society, excuse me, has done some very interesting work along this angle as well. And I can verify that there are companies that have residency sites that are NCOPE accredited that have invested considerable effort, time, and resources into this.
That's exactly what I was going to say. And I think it's really important to recognize that for a long time, the field of ONP has not necessarily represented practitioners, or the practitioners haven't necessarily represented the patient population in a physical way in terms of skin color and like socioeconomic backgrounds. However, that is something that across the board, everyone has been working towards, especially in the past year and a half. So these initiatives, while some of them are infancy stages, they are happening. And so this is DEI, it's not like a taboo topic, so don't shy away from it, but rather if it interests you to be part of the change, it's definitely something to consider as an opportunity to get involved in and to make the field better. Next question.
All right. One that Chris alluded to also, but we'll cover it briefly here. Will you hire me after residency? So if I say, I know I'm going to be a great resident, I hope you think, I will be too, but will you be hiring me after residency for a full-time position?
Yeah, that's a great question. And every potential employer is going to have a different answer to this, especially considering that some residencies are set up to be truly residency. You come in and then you leave and you seek employment elsewhere. Whereas other residency sites, they only hire residents when they know that they're also going to be then hiring them as full-time staff. So the conversation is definitely worth having. Chris already alluded to this in terms of how to, where you're trying to ask more of the underlying principle of what does the company believe? What is their philosophy on transitioning residents to full-time employees? You can ask for examples of individuals at the company who have started as residents and then learn where they are or how long that they've been there, if they themselves are residency directors or any other position as such.
And something to keep in mind is it incentivizes a company to an extent to effectively train you. They don't want to train you as a resident only to become a mediocre staff member. Mm-hmm. It behooves them to do the best they can in terms of growing you as a professional to benefit their organization and the patients that you'll ultimately serve as well. And that's something that's really unique about the post-academic residency model, where you are an employee and you're learning. But at the same token, if I were to get a job in private practice, again, I've been working largely in academia and administration, there would still be a period of time where they would have to reteach me how they perform certain tasks and opportunities. And residency is a unique way for a company to bring you into their system and processes very early in your career. And it's a mutual investment. You're giving effort and giving to the organization as an employee. They're providing you growth opportunities, and hopefully, if it's mutually amenable, the opportunity to stay on.
So here, regarding preceptor feedback and frequency of feedback, the question being, how many mentors will I have and how often will they provide feedback? Mentors and preceptors are interchangeable terms here.
So I love this question. If I were an employer looking for a resident, I think this shows a lot of self-awareness. It also is definitely a great question to ask at this forum in the resident fair. It's really important to know what learning style you do well with and what kind of feedback you need. I'm someone that likes pretty regular feedback, so I want to be able to improve and tailor my efforts that way. I also really enjoyed working with a lot of different folks, and that just so you know what kind of environment you're getting into. Okay, I'm going to learn from 5 different people. There's 2-week rotations. I'll get feedback every Friday. That can help you to figure out what skills you have to work on, and then kind of prepare yourself and figure out, okay, I'm going to get feedback on Friday. I should also evaluate myself for that Friday session and be ready to discuss with my mentor or preceptor. Chris, over to you.
And keep in mind, you can be data-driven for the first time within residency. So prior to the development of the NCOPE tracker system, there was a lot of anecdotal information where the resident would go, I feel like I'm doing a lot of KFOs. But within NCOPE tracker, you could actually say, I've done 17 KFOs the last quarter. I independently did 6 of them. I assisted on 7 of them. And the main diagnosis was spinal cord injury. So you now actually can be data-driven in terms of the conversation, the dialogue that you're having. The one thing that I want to remind everyone is while the residents fill out quarterly evals and the mentors fill out quarterly evals, that's NCOPE's check-in point. That's the minimum piece of information we need. It's the same way you got a grade at the end of a semester. That's the bare minimum that the registrar needs to know. Something that I want everyone to think about, and I can't take credit for this statement. It's Jennifer Wilder-Harrigan, and she's a preceptor and a talented clinical educator within the Hanger Clinic system. But she is very explicit about seeking input from your mentors. And there's some really great fundamental questions you could always ask. And those of you that have worked with me as a mentor have probably heard me ask the fundamental question of what went well, what could have gone better, and given the opportunity to do it over again, what would you do different?
Love those questions, Chris. So now we'll look at remote work and COVID. So I'll be the student in this case. So I'm really anxious about COVID, and we have a lot of in-person time at clinic. So what is your policy on remote work so I can have a little bit less time in person and get my work done at my house or another location?
This is a great question. Now, a couple pieces regarding this. Prosthetics and orthotics early on in COVID were deemed as essential healthcare, and therefore clinicians and clinics in general were able to stay open and provide care for their patients as best as possible. Now, what this means a year and a half into COVID and what this means about remote work, a lot of this has to also do with how clinician billing is done through insurance providers and the whole system, where currently virtual visits are not covered, and nor are like virtual appointments of any sort. So with that being said, it would be fair to assume that remote work is not going to be a huge option, if at all, for residents. But there's nothing wrong in asking for specifically about documentation, or if there's any flexibility regarding like non-clinical time and or any other trainings that are needing to be done, sometimes early on, or sometimes, just continuing education style credits. So this would be a question where we have to be very objective if we're asking it to anyone, because for companies over 100 people, 100 employees, there's the federal requirement for mandating vaccines at this point. So there's a lot happening where the question is probably not best suited for this Friday when you're meeting with employers, because there's likely not to be a flat policy. But if you feel very inclined to do so, there is no harm in phrasing the question as understanding what their COVID policy has been so far. Mm-hmm. Chris?
And to piggyback that, you're going to have regulations from local public health organizations as well. So for context, I'm in Illinois. So the state of Illinois has public health guidelines and requirements. Then I'm within the city of Chicago, which has another more stringent set of COVID protocols and guidelines for our hospital-based systems. And then I work in a subacute rehabilitation setting that actually cares for patients who are post-COVID. So we have very well-defined protocols and guidelines within our setting. So I could promise you, more than likely, you're going to have a pretty extensive onboarding and explanation of how these risks are maintained, because at no point is any care provider, whether you work in a large hospital like myself or even a small private practice, want to put any employee at risk, even the resident, even though you may be the new hire. There's no interest in putting you in that difficult spot. But understanding what procedures and protocols and public health measures are in place is something that is a fair question to ask. What steps have been done to help ensure the safety of not just the staff, but also the patients as well? Because at the end of the day, the patients are more often than not of a more vulnerable health status than the resident necessarily, or the staff.
Right. And I know we just have a few minutes left, so I might skip around a little bit just so we can get to some questions that may be a little bit more relevant, or if we haven't covered them at all. So Shri, I'm just going to skip over the next one. So will we fabricate our own devices? If the technical part was tough for you, Shri, would we fabricate our own devices as a resident at your facility?
Yeah, so every facility is probably going to have a different setup, especially if they use central fabrication setups, or if they do everything in-house or a combination thereof. This is a great question to ask about what kind of technical skill they would be, kind of expected to have coming into the residency, and also what they can expect to be doing in terms of both the patient care and fabrication. I know in Nina's and my experience, actually, there was a lot of technical overlap with the residents. And that is something that across the board we've heard mostly. Chris, care to elaborate?
You bet. I think you're going to find the full spectrum of opportunity. And the key is going to be figuring out what's necessary to complement your long-term career. So if you left school and you felt uncertain about your fabrication skills and you're thinking, I have to find a residency site where I can do as little fabrication as possible. That might not meet your long-term career goals if you move somewhere where the expectation is you manufacture everything yourself. So you really want to try to grow into being a well-rounded clinician. On that note, have the conversation, because there are some sites that I could verify the certified prosthetist, orthotist, and the residency director still laminate their own sockets on top of seeing patients, on top of running the business. And if that's something that excites you, and I know that's something that actually I really enjoyed when I was a younger clinician, there are opportunities there. But you're going to find organizations that have business models where they have as little as possible done on the manufacturing piece. They actually try everything they can to ensure that its central fabrication is done so well, you slide it on the patient's foot, put the shoe on, and have the delivery ticket signed because it fits flawlessly. So you're going to see variations in emphasis and understanding the expectations of what a certified clinician does with manufacturing versus the resident may be a little different as well. They may suggest, as a resident, you're going to get the chance to do some manufacturing, but recognize this is part of your training. And if we were to retain you as a staff clinician, we prefer that you spend the majority of your time patient-facing.
I know we're right up on time here, so we want to leave you with one last question.
Yep.
What would so you have a great conversation with an employer, and I'd love to keep in touch. So one way you can ask that is, I've really enjoyed speaking with you, and I really appreciate your time. How might I keep in touch with you? Go pass it to Shri.
Yeah, so this is a great question. Please, I encourage everyone to ask that every time you have a conversation. Finding out the best way to communicate is going to lead you to names, email addresses, phone numbers, LinkedIn, and the whole gamut of how to network. That is how you're going to be able to successfully utilize the next session, which is alumni networking. It's how you're going to best utilize the employer exhibit hall on Friday overall. It's also how you're going to be able to be successful just moving forward. If you stay at the same company for the rest of your life, great. If you move every few years, great. But the more you build your network, the more you have sustainable relationships where you know details about people, you're able to keep in touch, you're able to communicate about the things that matter. So some cool research that you're involved in or you read because, you guys spoke about it on Friday or at any other point, then you follow up regarding that. Or if it's about a device that you're working on and you know that this person was an expert in it or has a lot of experience in it, really some reason to communicate with them. So the question is super simple, like what is best to follow up and how is it best? The information you want out of the person you're asking is their name, their contact information, being email address ideally, and then connect with them on LinkedIn. It's not going to hurt. And then follow up with them at that, few weeks mark or right around the time that you're getting ready to submit applications or any other time where you see something that is mutually beneficial to the both of you to communicate about.
I know I'm supposed to pretend to be the expert, but I think Shri demonstrated expertise there. Beautifully put. I have nothing to add.
Awesome. And our last piece to share with y'all is please connect with us on our various social media platforms. Shri, anything else you wanted to add here before we close out?
Super simple. If you follow us along on social media platforms and you check out the link tree, which is linktree/NCOPE, you'll stay up to date with all of the upcoming events and resources. So this was the first of its kind, what we just started today being the resident fair. It was previously the Career Expo. And when we rebranded, we really wanted to focus on the residents from the start to finish process. So we're excited to be able to provide this, and we anticipate having further webinars and a kind of experiential back and forth of this style, hopefully with more Q&A. I would love to believe that we answered all of your questions before you had them, but I'm going to find a way to have you all engage even more in the future. So we'd love to have you follow us on everything.
Great. Well, thanks so much for attending, and we'll see you in the next alumni networking event that will take place in the exhibit hall. So we'll see you there.